Good morning. I'm Dr. Mirta Santos, Executive Director of the American Behçet's Disease Association and a patient advocate. It's a pleasure to be here. I'd like to thank Horizon and the Autoimmune Association for this important discussion. It takes the average autoimmune patient 7 years and 5 doctors to obtain a diagnosis. These numbers increase for those seeking a rare autoimmune diagnosis. Today, we will discuss and hear from 3 patient leaders about their journey to a rare disease diagnosis, about tips for living with a rare autoimmune disease, and recommendations for those still seeking a diagnosis. Panelists, please introduce yourselves. It's a pleasure to have you. Laquila, will you please introduce yourself?
Well, good morning, everyone, and thanks for having me here. I am Laquila, and I am actually living with a rare autoimmune disease, which is thyroid eye disease and Graves' disease. And with that being said, the journey took too long to be diagnosed. Because of that long journey of being undiagnosed, I lost my vision for 7 years. And I'm glad I'm on this panel today, so this will not have to happen to the next person who needs to seek a diagnosis.
Alexis, would you please introduce yourself and tell us a little bit about your diagnosis?
Sure. My name is Alexis Goodwin. I also like to be called Lex or Lexi, so you can pick. And I am living with a rare autoimmune disease called myasthenia gravis, also called MG, and it causes severe muscle weakness. I was diagnosed at the age of 19 years old, and it took me about 8 months to get my diagnosis. So I consider myself one of the lucky ones. I was pretty fortunate. At 19 years old, I was a sophomore in college, and I had this big picture for my life that I was going to be on the dean's list and make friends and fall in love. And what actually happened was the complete and total opposite. For about 8 months, I experienced symptoms like double vision, droopy eyelids, lack of facial expressions, and I went to countless doctors, and I even had a week-long hospital stay until I finally got my diagnosis. And from there, a year after I was diagnosed, I learned that around the ages of 10 or 11, I probably had MG, and it just went undetected, unnoticed. So it's been a long journey for me. It's been 6 years, but I'm here today to share my story and to bring awareness to MG and chronic illnesses and to advocate. And thanks for having me.
Thank you. Eric, would you please introduce yourself and tell us a little bit about your journey?
Yes. Hi, good morning, everyone. My name is Eric Alderman. I am a lawyer and I live in Westchester County, New York, just north of New York City. About 10 years ago, almost to the day, in 2011, in my early 50s, I was a very healthy person and had no issues. And then one day, I came down with a very bad flu, and it was the worst flu I had ever had, and seemed to have resolved in a few days after that. And I happened to be going to my internist a few days later for my normal annual checkup. And about 3 days later, he called me and told me that my blood counts and my red blood, my white blood, my platelets were all out of whack, and I needed to see somebody immediately to figure out what was going on. Luckily, feel very privileged. I have a very good friend who's a hematology oncologist in New York City, and I was able to see him immediately. And with that began the journey to try to find the diagnosis. So this was in February of 2011. Over the next few months, I had every test imaginable to see if did I have cancer? Did I have something that was going to kill me? That I was going to die soon? Here I am in my early 50s with two children who are teenagers, a wife who was a physician as well. Was this going to be the thing that that was going to end it all? And it took a few months, and we were able to rule out all of the bad things, all of the types of cancers that I might have. And after I confirmed the diagnosis with a hematologist who specializes in more benign types of things, not necessarily the cancer-related hematology issues. We were able to tell that what I had is called autoimmune hemolytic anemia. What that is basically I have auto antibodies in my body that attack my the production of red blood cells and cause hemolysis in my red blood cells and cause my red blood cells to be destroyed much earlier than normal. And it's harder for my body to compensate for that. So I get a lowering of my hemoglobin, and it causes me to be very tired and other things. But it was good to know that I had, while I had something that was that wasn't going to end my life immediately, I did realize that it was going to be something chronic that I would have to deal with probably the rest of my life. And here I am 10 years later, and I've had a roller coaster of good periods and not so good periods. And I've tried with my friend who is a hematology oncologist, as well as doctors who I was able to see, national experts in the field. We're able to come up with alternative treatments that are able to, instead of being on this big roller coaster, I'm on one of these little teeny tiny roller coasters. So my goal is to keep within a certain boundaries so that I don't get the high highs and the low lows, and to try to get off of prednisone and steroids as my main treatment, and try to find other treatments that might be able to control me and keep me within boundaries that won't have the same effects on my body that long-term steroid use might have. Anyway, I probably talked long enough, so why don't we turn it back to Mary?
Thank you so much for sharing your stories. How do you want to help or guide those who have been diagnosed with a rare autoimmune condition and those who are still undiagnosed? What would you recommend for patients seeking a diagnosis and for those that are newly diagnosed?
I'll start. I'm sorry.
Go ahead,
I think
go ahead.
today being here is the first step, being surrounded at summits and support groups, being surrounded by more information and people who are going through the same and similar journeys. Just surrounding yourself with as much information as possible. Research is your best friend. It's important to be knowledgeable, not just about your condition, but also yourself, because this is a new adjustment. This is a new change. You'll have different limitations, and it's like a whole new you. So just making sure that you're documenting, just aware, and really,
document.
Yep, learning your new body, your new life.
Laquila, what would you recommend?
I'm going to piggyback on Lexi and say that what I definitely recommend is when you are being diagnosed, get more than one doctor's opinion. And I think that's where I went wrong. I was only seeking one person's opinion one at a time. You need 3 opinions. And if you get the first 2 doctors to agree on the exact same thing, then you're taking the right steps and on the right progress. And I also would like to see, this is my hope for the future, more pamphlets in the doctor's office on thyroid disorders, because if you go sit in your doctor's office, there's nothing in the office that speaks of thyroid issues. And if they did that, more women would be aware and probably could detect their own symptoms and ask the doctor to check their thyroid levels.
Yeah, I would add to all of that. I would echo all of that, and I would amplify it. I would say, and I had 4 points that I wrote down: connect with specialists. And the way of doing that is to read. Go online, go Google. Along the lines, I don't know if everybody had the privilege of hearing Lauren speak earlier as the keynote. Read anything you can in any way that you can about your condition. And with that, you learn who the real specialists are, not only in this country, but around the world. I learned one of the major specialists in the condition I have, autoimmune hemolytic anemia, is a doctor in Italy, and I've made connection with her. And you also want to check the NIH clinical trial website all the time, and see if there are any clinical trials. I was involved in one clinical trial, and with my goal of trying to get off of prednisone if I can. That clinical trial for me didn't necessarily work, but it may work for others. My second point was to get involved, connect to other people who have your disease. There are, websites now, Facebook groups, and organizations that you can join that help you get connected. One thing with my disease, at least, is it seems like every single person who has it a little bit differently, that no two people have it exactly the same. But I think there are enough common things that connecting with others can help you a lot. The third thing I would say is control what you can control. You can't control everything. I've been trying for 10 years to try to figure out why did I get this? Why was it that flu that I had? Did I pick up some sort of a virus that triggered my immune system to cause all of this? Was it something else, in the past? Was it the fact that I got a vaccine for chicken pox because I never had it as a child? All these things go through your head. You want to try to figure it out. Don't try to figure it out. Just deal with what you can control. Deal with treating yourself, making yourself feel better. And the last thing I would say is you're going to have high highs and low lows. Just try to do anything you can to control so that you keep on within a normal range as possible, to avoid those high highs. So whatever you can do to control that is definitely something that you should be thinking about.
I think those are wonderful recommendations. I want to add that in my organization, in the American Behçet's Disease Association, one of the patients who was diagnosed with Behçet's disease, there was so little known about Behçet's disease, and she decided to get involved, and she researched everything. She became a hotline operator to help patients through their journey. Then she became a board member, and she advocated and did wonderful work, really educated herself about her disease in order to help others. So that brings us to our next segment. Why is it important to advocate for yourself as a rare autoimmune patient, and how can you effectively do so? Laquila, could you, we'll leave Laquila for last. Lexi, could you please tell us why you think it's important to advocate for yourself?
Advocating is so important because no one's going to take better care than you. And it's important to realize that you have a voice and that you have a say. And it's important to speak up for yourself. With a rare disease, there's no manual or how-to guide to help you through this. So you're pretty much in control of your journey. And that's exactly it. You're in control. So when you go into the doctor's appointments, remember that. Ask all the questions that you can. Get as much time as you can. And like Eric pointed out, in Laquila, if you don't agree with what someone said, what the doctor or a physician says, find another one. There are so many resources and outlets out there for you. Really use your voice and make sure that your journey is what you want to get out of it. And like Eric pointed out, control what you can control and really embrace this. There's going to be high highs and low lows, but there is hope. I was diagnosed 6 years ago and there were no summits, and now look at us. So there is hope, and there is, a better future and a brighter future ahead. So just hang in there and keep going.
Eric, any suggestions?
Yeah, I guess, what I would say is you have to be an advocate for yourself. But I even look at it as a, the greater good, if there's something that I can do to help myself that can also help others, like being in clinical trials, like being in, I'm on the board of an advocacy organization that's just getting started for my autoimmune hemolytic anemia, the warm autoimmune hemolytic anemia warriors, WIA warriors. And if I can help others too, certainly, my primary focus is myself, but I also do want to help others who have this, condition. Like I said, everybody has it a little bit differently. So even if I do something that, hopefully it'll help me, but if it doesn't help me, it's going to help somebody else, and that's pay it forward. And, if you pay it forward, eventually it'll come back to you in other ways too. So.
And that's so true. And I think part of the journey, when you receive a rare disease diagnosis, when you receive an autoimmune diagnosis, and you have both, part of the journey is feeling isolated. And it's so important to connect with others. And it's so important to feel that you belong to a community that cares and that can support one another. Laquila, would you please share with us how you can help patients effectively advocate for themselves?
Well, I call these Laquila's 8 steps to advocate, which is an acronym for each letter in the word advocate. The first step is always journal your feelings, your symptoms daily or weekly. D, do this because you love yourself. Each day will get better. And in doing these things, you will have a victory. And through the victory comes opportunities in the form of better doctors who will not just hear you, but he or she is listening, and then they can answer your questions. And if they cannot help you, then they can refer you to someone who can. Count on you. Count on you, because you may not understand what's happening to you, nor do you have time to explain what is happening to you, to people, because it slows down your process and progress. Advocate. Once you have mastered steps 1 through 5, you can advocate for yourself as well as others. And with doing that, you both give yourself strength. Now you can build your team. You build a team of supporters, and that's step 7. You build a team of supporters and caregivers because you now have a better understanding of your rare disease, and you can help your team understand what your needs are and how they can help you best. Number 8, which is experience. You have more knowledge and understanding and more experience in your rare disease that has caused you emotional and physically and spiritually pain. And I also want to add, but we can also turn that, what I call the PSP, which is pain and suffering, we can turn it into power. And that's it.
Thank you so much. I love that. We hope to help end the diagnostic odyssey. The long road to a diagnosis is so difficult, and it affects our health, our well-being, our mental status, our survival rate. But we want you to know that you're not alone in the journey, that we're here to support in any way we can, and that we understand what you're going through. Thank you for your time. Thank you for watching this presentation, and we hope everyone is able to feel well in the days to come.